Maybe you eat right and get enough exercise, but sometimes you need just an extra boost to tackle nagging conditions. And Dr. Beverly Huang is joining us, a naturopathic doctor with Grassroots Naturopathic Medicine. And you're here with some prescription for what's good for what ails you. So we have some common ailments that you would see in your office.
Yes.
Okay, so we're going to walk through all of these. Let's talk first about eczema, which is up here.
So eczema is essentially a chronic recurring rash. So usually there's a little bit of redness, some dryness, itching with it. Although there's some more underlying things I usually examine with a patient, there are definitely certain supplements that can be very helpful as well too.
Okay.
The first one I'll start with here is a very good fish oil. So fish oil is high in omega-3s, in particular EPA and DHA, and where in a higher dose can actually reduce the inflammation in the skin. So that can help with the redness.
Yeah.
Probiotics here, again, looking at the good and bad balance of good and bad bacteria in your digestive system. When that's out of balance, you can see more chronic issues like eczema come up. So good probiotic is usually a good way to start as well.
Okay, great.
And then if you're looking for something topical, the calendula. So calendula is a plant that can be very soothing for the skin. So when you have extended winters like we have right now, but long, dry, harsh winters, something very soothing for the skin can be certainly helpful at this time of year.
Okay, fantastic. And how long do you need to start taking fish oil before you'll see a benefit?
Usually about 12 weeks.
Yeah.
Clinical trials show that after 12 weeks of use, you'll see a reduction of some of the inflammation and the symptoms with that. And we'll touch upon that a little bit later as well too.
Great. Let's talk about nausea, and we've got this up front.
So nausea's tough to treat.
Right.
It usually depends on what's happening. So usually is it, are you pregnant? Is it from morning sickness? Is it from indigestion? Is it from perhaps a supplement medication that you're taking incorrectly as well too? So look at that first. Ginger is one of the most common things that people will turn to for nausea. It comes in a tea, you can find it in a supplement, or you've even seen it in chewing gum as well too. It helps to quell the nausea, and it has been actually shown clinically to reduce morning sickness and post-operative nausea as well.
Right, that's so important, especially if you're not wanting to take anything other than natural substances. Okay, what about this one?
And that's a digestive bitter, so that's great if your nausea is more due to indigestion. So it helps for your stomach to reduce some of the issues that you're having with digestion by promoting proper enzyme production.
Okay.
So it can help with the digestive aids. So if you're digesting your foods better, some of that nausea will go away.
What is a bitter?
A bitter is a plant that essentially is bitter in nature, but it actually helps to get your liver producing and releasing all the stomach enzymes and bile to help break down the foods that you're eating.
Okay, great, fantastic. Let's go to inflammation.
Okay, so inflammation, I'm going to touch upon fish oils again. So this is just a capsule form here. In a higher dose, it can reduce inflammation. With the higher dose of a fish oil, you do want to consult with a naturopathic doctor because it can interfere with medications such as blood thinners.
Okay.
So you want to be careful before you go into those higher doses.
All right.
And then this is turmeric or curcumin. Turmeric is a spice that gives curry its yellow color.
Yes.
But you need to eat quite a bit of curry to be able to get a therapeutic dose of the curcumin, which is the active ingredient.
Okay.
So a supplement form would be a little bit more beneficial, and there is good clinical research behind curcumin in helping to reduce inflammation.
Okay, fantastic. We've got about a minute left to get to stress.
So stress is a big one that we talk with almost everyone. B complex is a must. You make sure it's a great form, great for absorption. We go through so much in a higher stress form. If you're having more of an emotional response with stress, the Zen-theanine is fantastic. It helps to reduce some anxiety by producing proper alpha waves in the brain. And rhodiola here is a plant that has been shown to help for us to adapt, which is essentially what stress is. It's great for reducing fatigue and improving mental focus, which we could all benefit from.
Fantastic. Do we have time to talk about sleep deprivation? Very quickly.
So sleep, melatonin is often one to go to, great if you're jet lagged or work shift work. Magnesium is great for relaxation, and I always talk about sleep hygiene. So shutting down your devices an hour before sleep, TV, phone, smartphone, backlit, e-readers. Just start quieting down the brain.
Yeah, all of those lights infiltrating our brains. Thank you so much.
You're welcome.
Dr. Beverly Huang with Grassroots Naturopathic Medicine. Great to see you. Great advice. I've been taking notes, especially on the sleep deprivation. Dave?